the repair studies are designed to show target engagement. They're not designed to show any clinical benefit. Now, we get the same two questions from people who are unfamiliar with Clene, and that is that how do you know that these gold nanocrystals actually get to the brains of human beings? And if they do get to the brains of human beings, how do you know that they have the bioenergetic effects that you say they have? So we're using technology called P31 or phosphorus 31 magnetic resonance spectroscopy. So P31-MRS or magnetic resonance spectroscopy is a way of investigating bioenergetic molecules non-invasively in vivo. We're using a very high field strength magnet, a 7 Tesla magnet. The study is being done at UT Southwestern in conjunction with the neuroscience research group there. And so we have one study in MS patients, one study in Parkinson's patients, and a study that has not yet begun in ALS patients. So basically what we do is we image the patients at baseline, and then we re-image them after at least 12 weeks of exposure to CNM-Au8. Now, this is an open label study. There's no control group, but there are 3 doses that we're investigating, and the patients and the investigators are blinded to dose, but all patients are on active drug. So what we've shown is that we have increase in NAD to NADH ratio for the vast majority of patients. And some of those increases are substantial. And the other thing, which is, I think, more important and has never been shown before, frankly, is we're showing normalization of brain bioenergetics in these patients, as evidenced by looking at alpha, beta, and gamma ATP. Now, ATP or adenosine triphosphate has 3 phosphorus groups on it. And we can investigate each one of those phosphorus groups independently with this technology. And so we call those alpha, beta, and gamma ATP. It's just the 3 different phosphorus atoms on the adenosine triphosphate molecule. And when we look at any of those 3, what we show is that there's we do a regression analysis looking at change in ATP in relationship to the baseline value. And we show normalization of ATP, both alpha, beta, and gamma ATP. I think we presented alpha and gamma ATP in these data. We show normalization after exposure to CNM-Au8. That is to say, patients who have low ATP at baseline, their ATP increases. People have high ATP at baseline, and you can actually have high ATP for pathological reasons. So if neurons are not producing ATP, the glial cells, the astrocytes especially, will actually make massive amounts of ATP in order to support the neurons. So they will dump ATP out in order to try and support neurons. So you can actually have high ATP in pathologic states where neurons are starved for energy because they're not making their own ATP. So we saw normalization of high ATP, again, back to a normalization factor with the R. So we do what's called a correlation coefficient, showing what is the correlation of exposure to CNM-Au8 to this change in ATP. And the correlation coefficient was 0.9, meaning that 90% of the change in ATP can be explained by the addition of CNM-Au8. So we were, this has never been shown before in human beings. So we're very, very, again, encouraged by these data.